There are different barriers. The main barrier is us. I don't think we believe in ourselves enough. Nurses are not aware of how amazing they are and how amazing they are for patients, because they are the point of contact and they know a lot about their patients. I think that's the main barrier, is that we need to believe in ourselves. The other obvious one is time. So when we are running in the wards, we always do what we have to do sometimes we forget to speak with the patients. And that teaching, we are not aware of how important it is. The patients go home and we actually want them to feel comfortable enough to go home and to manage themselves. If we don't tell them what may happen, the good and the bad, they are not able to ask for the real advice when they need it. And there is always a barrier that we think is the biggest one, but actually it's not. That it's how we work with the multidisciplinary team. I think nurses are quite afraid with the relationship with doctors, and actually doctors work really good with nurses. We are very proud of it, but we are very afraid of recognizing that we can speak to a doctor and say, I need you, this patient is poorly, because we feel that's not our role, and actually it is our role. We need to continue educating the team and educating them together. I think ESMO is a great example of how we can do it together. Nurses need to be developing, doctors need to be developing, all the allied health professionals need to continue doing education, work in the communication. So there are great examples of meetings together. So the MDTs that normally are, or doctors with physiotherapists, we should actually be all together. And when the doctors go in the ward rounds to see the patients, the nurse would always be with them, because they are the ones that are 24 hours with the patients.